Good evening. Namaste. I hope you had a good 4 day.
Namaste.
Namaste. Welcome, Galia from Peru. And I'm also joining you to welcome the people, the audience here, who had a 4 day of treat to a workshop on Six Sigma, the quality assurance program that tells us how to implement yoga, implement quality assurance in yoga and any of the research projects. So today we are now back to uh, our learning and the learning outcomes from yoga. And we are today going to fly you to a beautiful country called Peru. And we are here in Peru and we are joined by Galia Lierena Velasco. And she's been working, I will introduce you to her. She will, of course, be speaking today on yoga in the cancer care, and she's a yoga teacher and a stress management and special groups, that is people who are living with HIV/AIDS. She works with them. And you know what, she's trained at the Indian Cultural Center, the Embassy of India in Peru and Bolivia. uh, and she this is certified by the Ministry of Ayush, Government of India, under the scheme of voluntary certification of yoga professionals, and certified by Quality Council of India. I believe this is the program that the Quality Council of India started for certification of yoga professionals, level 1, level 2, and now we even have level 3. Is that right, Galia? Is that the same program?
Yes, it's right. It's right. It's now currently handled by the Yoga Certification Board.
Yes, Yoga Certification Board is, yes, that's the board which is now has members Dr. H.R. Nagendra and Dr. Jaideep Arya, and it has been transferred to that. That's correct. So Galia is also the secretary. Galia is secretary and the program director at the Ayush Certified Yoga Professionals Peru Association. So Yoga Professionals Association of Yoga is there in Peru, and she heads it as a secretary. And this particular program offers teaching of the traditional Indian yoga. And she's the director also in her personal capacity. For a business, she runs a Galia Yoga and Travel program, which she offers as consultancy to the people there to travel across the world. And for yoga, she has been visiting various national and international conferences. She delivers talks there, performs sessions. So she's at heart, a yoga professional and a yoga enthusiast. So today she's going to be talking to us about yoga for cancer care. And I believe this is going to be palliative care. And she's kindly requested to also give a small session. So let's join her and listen to her, listen to her thoughts, and what new breath of air she brings from Peru. Welcome, Galia. Welcome to our program. I'm going to switch off my video and I'm going to have all my eyes and ears along with all the viewers on you. Welcome. Welcome to you.
Okay. Thanks you so much, Akshay, for the invitation. Good morning, everyone. You know, here in Peru, it's morning, 7:30 a.m. So welcome to my country. And we're going to do today yoga for cancer. This is a subject very close to my heart because I'm not only a yoga teacher, I was telling Akshay, I'm also a cancer patient. So I want to share this from that perspective. And I'm going to present a very brief PowerPoint to tell you what is cancer, because, you know, I've been asking around of friends, people, different people, colleagues, what do they know about cancer? And it's surprising how little people know about that disease. So if you allow me to share my screen, I will share this with you.
Yes, you're all allowed from our end.
Okay. Okay, can you see it?
Yes, perfect. Please go ahead.
Okay. So let me. Okay. Good. So first of all, we want to know what is cancer. Although cancer is often referred to as a single condition, it consists of more than 100 diseases. These diseases are both and the spread of abnormal cells. Cancer can arise in many different parts of our body, behave differently dependent of the organ of origin. Cancer happens when cells that are normal grow and spread very fast. Normal body cells grow and divide and know to stop growing. Over time, they also die. But that doesn't happen with cancer cells. They just grow and grow, continue growing and don't die when they're supposed to. When this happens, we are going to get very sick. So cancer cells usually group or clump together, forming tumors. A growing tumor is a lump of cancer cells that can destroy normal cells in our body and damaging surrounding tissues. Sometimes it will happen that these tumors, these cancer cells, will break away from this point of origin and spread to a different part of our body. And that will be called metastasis. Doctors are not sure why some people get cancer and some others don't. But what we know is that cancer is not contagious. Cancer is a disease that has many risk factors. Now, among them, we have smoking cigarettes, drinking too much alcohol, having an unhealthy diet, too much fats, processed foods, too much sugar. And we must go in place of that, we should be eating more fruits and more vegetables to prevent, because the key here in cancer is prevention. So another risk factor is the sun. Now it's so nice to go and enjoy a summer day, but we have to do it wearing proper protection to avoid skin cancer. So, okay. So in cancer care, we have this pre-diagnosis phase. It's a time from either yourself or the doctor. You see that something is going on. You have this suspicion something is happening, and that you are not quite sure what it is. And this journey, it's indeed a very long wait. In my case, for example, I have an annual checkup. Annual checkups are a very good idea, and I suggest everybody has these annual checkups. And the point is, I got my annual checkup, and when I went to pick up the results, I got this in the report, this message in the report, something suspicious. That required more testing, and that can be very stressful for a person, because you go from this initial suspicion to a test. A test can be an imaging test to see what is going on, but that will lead to another test, another wait. Now, it's never everything's in the same day. We would love to have everything on a single day to know if we have cancer or not, but that will never happen. That's very, very strange if that's happened. So you will get another appointment to have your test. It can be an ultrasound, it can be an MRI or CT scan. And then you have to wait for the results of that. So having those results, you will have to go another test, maybe a biopsy. And time will continue passing until it can be a month, maybe, until you have all your results and all the appointments ready. And then you will finally get your diagnosis. And that diagnosis, depending on the stage you're in, can be devastating. But it is the anxiety, the fear, all those things that you can be going through, waiting for those results. So what can we do in that case? before we go to that, we are going to see the treatment options. So this is very important to know. Most people think that only available treatments for chemotherapy and radiation, but that's not true. There are similar treatments available right now. So usually, as I was mentioning before, when you have cancer form tumors, and tumors will require surgery. So almost every cancer patient will need to undergo surgery. And it can be before that or after the surgery that you will need, even during the surgery, you will need radiation. So other treatment that we have is chemotherapy. Chemotherapy uses drugs to kill cancer, but we have now also hormone therapy, and that hormone therapy is used in breast cancer, for example. Now, any cancer that grows due to the action of hormones, then you have to remove those hormones from the body or blocking their effects to prevent the cancer from growing again. Now, for that, you will use selective estrogen receptor modulators. That is very common in case of breast cancer and prostate cancer. We have also targeted therapy, that's a type of treatment that uses drugs and other substances to identify and attack specific types of cancer cells with less harm to normal cells. And of course, there are some other treatments we have. There's bone transplant, stem cell therapy, and among others, but these 5 are the most common treatments for the majority of patients. So how yoga can help? We know yoga reduces stress levels, help us insomnia, help lift the mood, and makes our muscles and joints more flexible. Yoga is a natural way to cope with all the things we're going through when we receive our cancer diagnosis. And it's great, to start our yoga journey as early as possible. Now, some people use yoga only after treatment, but indeed you have to use it even before you begin your treatment, because it will help you to have a more balanced mind, and more accepting, and what it's going through, what you have to go through. So that is probably very, very, very helpful now. Yoga will help us also in reducing symptoms and side effects that we will have, like pain. The pranayama is very useful to manage pain. And not only that, we can use yoga techniques to combat fatigue and tiredness. That's very common in many different types of cancer. The patient will feel a lot fatigue, will feel tired all the time, sleepy all the time. And what is curious about this, if you feel fatigue, but then you can sleep at night. Even if you don't sleep the day, you can sleep at night. So it's yoga will help us with that, with very simple techniques, with very simple movement. We will be able to relax and rest more. So also, another thing is we can't move very much when we have, for example, after surgery. After surgery, if we are yoga practitioners, we have to stop our asanas for at least 6 months. Yeah. And what will that cause? No, we will feel stiff. We will feel the tension building around our necks, our shoulders, upper back. So what can we do for that? We will use yoga. We can use Sakshma Vayama, which are subtle movements that will stimulate every part of our body from head to tell. So yoga will stimulate the nervous system, will make our muscles and joints more flexible, and relax our mind and the body. We have to be cautious though. No, we have to be very careful because every patient is different from the other, and we have to take care of the specific needs of each of these persons. So please, if you have never done yoga, don't do it without the advice of an experienced yoga professional. And obviously, previously discussing it with your doctor, who will be able to tell you if you can do these exercises or not. Now, in our yoga journey, we have to keep in mind that yoga is not only asanas, it's not only pranayama. Yoga is it's a holistic approach. So we have to keep in mind the first step of yoga, which are dhyana and niyama. Now, I came across this quote that I like very much is the idea of a yoga practice is not just to focus and be aware, mindful, and calm for the time we're doing the session, but to carry this state of being with us when we leave the class. So I think we all know what yama and niyama are. No, these are yama are the social codes, and niyama are observances that we as yoga practitioners follow. These are very important. We, especially, particular for me, santosha, contentment. Accepting the things as they are, and be able to not only accept the things as they are, but being grateful for the experience, because we can learn so much from experiences, either if they are good or bad, we learn. And what do we do with this experience? No, we learn and we share with others. And here it comes this concept of karma yoga. What do we do? How do we share with others? How do we help others with our own experience? It's a very beautiful concept that will help us a lot through our journey and in life in general. Have to strive to live a peaceful, spiritual life. No, it doesn't matter when we talk about spirituality, many people think religion, and it's not, it really doesn't matter what religion you follow, what you believe in. Spirituality is much more than that. It's your connection with yourself and the universe. So that will be very, very important. And of course, abhyas. Abhyas is a constant practice. None of this will be useful. Yoga won't be able to help us if we don't practice it constantly. Now, it's not taking it just once a week. That will not be helpful at all. We have to practice every day for at least a few minutes. And in general, as I was mentioned before, we have to carry all these principles through our lives and through the day and through our lives. So, well, that's it with the presentation, and I'm going to stop sharing. I hope that was clear. And very brief things I wanted to share this with you because it's important to know. Please keep in mind prevention is key. We really need to prevent, to do our checkups, to have a healthier diet, to avoid getting this disease. So I'm going to stop sharing.
You've already stopped. You're in
okay.
full view.
So that we're going to do now a little practice. Suksma. We're going to do it on a chair, a very gentle exercises. Just a second. Okay. Okay. Visible there?
Yes, that's good.
Can you hear me?
Yes, perfect.
Okay, perfect. So we're going to do a very easy practice today. It's very gentle. Now, we are going to do it. Keep in mind that, as I mentioned before, surgery is something that's very common at the beginning of our treatment. So keep that in mind. We are going to do these movements, being very careful not to stretch anything here in the torso area. So, and why are we going to do this? I was advised to do pranayama and mostly pranayama, and that's a great tool to get better, to feel better. But it's important to prevent being stiff. That's a very common problem when you have surgery. You have to stay resting for so much time that you begin to feel stiff, you begin to feel the tension in your neck, in your shoulders, and it's very, very uncomfortable, very painful. So the way that we're going to do this, we're going to practice, and when we do such pranayama, we indeed work our whole body. So the first thing I want you to do, you can do this on a yoga mat. If you have difficulty sitting on a mat, you can do this on a chair. Just be keep in mind that this chair has to be a firm chair where your legs can be in a 90 degrees from the floor. Just open your legs a little bit. Plant your feet firmly on the floor, back straight, and we're going to start with head movements. So first of all, we're going to, you can put your hands in your lap, and we're going to inhale and exhale to the right. Inhale back center. Exhale to the left. We're going to do this 3 times. Inhale. Exhale. Inhale back center. Exhale left. Inhale back center. Exhale to the right. Inhale back and exhale to the left. Keep your spine straight and don't make any movement that you feel is uncomfortable. If you feel pain, if you feel uncomfortable, please stop doing it. Now we're going to inhale. And we're trying to take our ear to our chest. So inhale, bend our neck. Don't strain your neck, gently. Inhale back center and exhale to the other side. Inhale back center, exhale to the other side. Inhale back center, exhale to the left. Inhale back center, exhale, and inhale back center. Now we're doing some rotation of the neck. We're going to inhale. We're going to put our head and start making rotations, inhaling and exhaling to the other side, gently. Don't make any jerk movements. Now inhale to the other side. You can repeat this 3 times. I'm going to do it just once because we don't have much time. But when you do this kind of movements, you will feel how you release the tension in this area. Now we're going to do some shoulder movements. You're going to put your hands here in your hips. And then you are going to inhale up, exhale down. Inhale up, exhale down. Gently, once again, inhale up, exhale down. Now you are feeling all the tension that you are releasing from this area. Now we're going to do a movement with our hands, our arms. We are going to take our arms in front of us, inhaling. And we are going to put our palms upwards. We're going to inhale and exhale. Small inhale and exhale. Inhale, exhale. Now we are going to put our arms to the sides. Inhale. We are going to make a fist like this. Thumb goes inside. We're going to make a fist, and we are start doing some rotations of the wrist. I'm going to do it one side. 1, 2, 3, 4, 5. And now we are going to do it the same but in different direction. 2, 3, 4, 5. And relax. We're going to avoid doing any kind of exercises that takes our hands over our head. No, this kind of movement. Because if we have a recent surgery that will stretch the muscles in this area, and we don't want to do that. This kind of exercise that we're doing now is just for everybody. If you have recent surgery, you can do it safely. So next, we're going to do some very gentle twist to the side. We're going to keep our spine straight, and we're going to put our left hand on our right knee and take our right hand to the back. Very gently, very softly, we're going to inhale and turn to the back. Exhale, and center, and we're going to do the same to the other side. We put our right hand on our left knee, our left hand in the back. Inhale, and exhale, going back. Inhale, back center, and you can repeat this 3 times. Now we're going to do some leg movements. I don't know, I think my feet can be seen, but I hope you get the idea. First of all, we're going to lift our legs. We're going to inhale and lift our right leg first, keeping our foot in 90 degrees. Inhale. And we exhale. We are going to do a movement like a pendulum. So inhale, exhale, go down like a pendulum. Take your foot back. Inhale up, exhale. Now we are going to do the same with the left side. We inhale and exhale. Take your foot back. Inhale, up, keep your foot at a 90-degree angle. Exhale, go back. Inhale, up. Exhale, that will help with the knee joints. And now we are going to do some movement with our ankles. We are going to take our foot up again. And we are going to inhale, taking our foot in 90-degree angle, and exhale, taking it down. So inhale up. I don't know if you can see me there. Inhale up, exhale down. Inhale up, exhale down, inhale up, exhale down. And now we're going to do rotation. First, to one side, we're going to do it clockwise. 1, 2, 3. Now to the other side. 1, 2, 3. With the left foot now, we are going to raise our legs and we're going to inhale up, exhale. Inhale up, exhale down. Inhale up, exhale down. You will feel a very nice stretch here in your leg. Now we are going to do rotation. Our leg up, and we're going to do it first clockwise. 1, 2, 3. Now to the other side. 1, 2, 3. Okay. So with that, we have work with all our body, now from head to toe. There are many more practices we can do, but we have very little time. I think I have exceeded my time goals, so we're going to stop here. And hopefully some other day we can continue doing some other exercise that will be very, very helpful. So thank you. Thank you so much for having me here, and I hope these are useful exercises for all of you that very gentle, anyone can do.
Thank you, Galia, for a nice couple of slides you showed about cancer, the diagnosis, the time taken for it, the pain that the one goes through, and then the nice soft movements which are called Sukshma Vyayam, or the warming up exercises. They were very smooth. I had a very busy day, just to share. I'm sure my viewers also had a similar experience throughout the day as we inch towards weekend. Very busy day with lots of WhatsApps, emails, actions, discussions. But as I followed you, I feel very relaxed and very nice. So thank you for joining us from Peru. I also want to let you know and let the viewers know that this particular program is being run on behalf of the Integrative Medicine Case Reports, which is the only journal in the world that publishes case reports for the documentation purposes, for any of the results of individuals who benefit from yoga or the Ayush system. And please check in our website, jimcr.com. The July issue is just out, and there are very good articles on different therapies outside the modern medicine fold, but with rich evidence, internationally peer reviewed. The ISSN number has also been assigned. And Galia, we invite you to join us tomorrow. I don't know what time it will be over there, maybe midnight, 12 noon in India. Tomorrow we celebrate the Teachers' Day, and we have an interactive session with the students from class 6th onwards. And we have 3 experts tomorrow. One of the India's top immunologists, in fact, one of the world leaders in immunology, that is Dr. N.K. Mehra. He is the former Dean of All India Institute of Medical Sciences. And we are also joined by one of the accomplished sportsperson. His name is Mr. Gopi Chand. He is a badminton player and the national badminton team's coach. and also Dr. Atul Padnekar, who is a specialist in yoga psychology. We've had a huge response of more than 39 schools and as many kids with questions, and we are all planning to have a great session. So please join us, Galia, for the tomorrow's program.
Definitely.
And
Thank
we
you
hope
so much for the invitation. I will definitely be joining. Thank you so much. And thank you once again for having me here.
great. And we can see that this is winter time for Peru because you're in the southern hemisphere. So even
Yes, it's
though,
very, very cold here.
yeah, we can tell. So thank you once again. Namaste from India, and thanks to.
Namaste from Peru. Thank you so much.
Thank you. Bye bye.
Bye.